So hello friends, I hope I'm audible and visible. Can I get a quick thumbs up from all my dear students? I hope you all can hear me. My audio video is all fine. So welcome all of you in the next session of Must Know Questions in Dermatology. I'm Dr. Chesta Agarwal, your NEET PG educator on the best online platform, that is Unacademy. Now we have scheduling a All India mock test on popular demand with a change of date. Initially we have pronounced the date or declared the date as 19th, but now it has been shifted to 26th Feb. I request all my dear students to please be live on this All India NEET PG or All India mock test. This is a free test. You just need to enroll yourself, and that can be easily done using my code, that is CHESTA10. So please use this code CHESTA10 and get yourself enrolled for free. Please get yourself enrolled for free. We have two types of subscriptions. One is Plus, which give you an access to Unacademy live classes from the top educators. Iconic give you an access to both Unacademy and Prep Ladder. I congratulate to all my students who have cleared their FMG December exam. Now this is the schedule of the free class sessions. I hope everybody have given the 2nd and the 4th February free class test. Now this is the schedule for the remaining days. Today we have at 7 p.m. a NEET PG 2022 PYQ for ENT, ophthalmology and anesthesia. I request again that please use this code, as these are the free tests. You can easily access this by using my code. We have free live classes which are known as special classes. I do take special class every day at 3 p.m. This can be seen by anybody. You just need to download the Unacademy learning app, go to my profile Dr. Chesta Agarwal, and ma'am, can I take a plus subscription for my NEET PG? Shubham, definitely you can take a plus subscription right now. I would recommend you to take a 2-month subscription, which is around 6750 right now. You can use my code CHESTA10, and if you can also go for a longer subscription of 3 months using the same code, that is CHESTA10, CHESTA10. It will be actually beneficial for those who are not fully prepared for the exam. I think the postponement of the exam is a good news for many of them. We have a highly effective question bank of 25,000 plus question, and we have a feature which is known as raise a hand. If you have any doubt, you can just raise your hand and ask your doubt. Now these are the batches which are about to start on 9th of February. That is the NEET PG high yield batch, focus FMG batch, NEET PG image based MCQ, and NEET PG ultra fast revision batch. We also have a target next integrated system wise batch which is starting on 9th of February. We have a lot of system wise discussion of the subjects here included. Now please remember, the iconic prices has dropped. Iconic subscription means you have an access to both Unacademy and Prep Ladder. So initially if you take 1 year of Iconic, it was 52,500, but now it is 48,000 rupees, and if you use my code CHESTA10, CHESTA10, so you can take it in 43,200. So from 52 it is 43, almost a 9 to 10,000 rupees drop on Iconic, but these are 1 year and longer subscriptions. If you want to take plus, we are still going on with the same offers of 2 month 6750 and for 6 month 20,250 rupees. So Shubham, you can definitely go for a plus subscription using a code CHESTA10 here. Starting with the first question of the today's session, please answer the first question. This was a case of 29-year-old young female presenting with recurrent oral genital ulcers. Eye lesion usually start in one eye and then passes to another eye. They are like iridocyclitis extending very quickly to another eye. Which of the following will never be seen? Which of the following will never be seen in these individuals? What will be the answer? What will be the answer? erythema induratum, erythema nodosum, furunculosis, and superficial thrombophlebitis. Which of the following will never be seen in these individuals? Anyone? Shubham, if you have any query, please let me know. Anything related to the icon plus subscription of Unacademy, please let me know. We have these offers for a very limited time period, and as the exam got postponed, so it's a very golden chance for the intern students to rapid fast their study plannings or their preparations so that they can very easily cover the remaining parts. The correct answer of this question is option number 1. Please remember, erythema induratum is a feature of tuberculid, that is an hypersensitivity reaction second to tuberculosis of the systemic tuberculosis. This is the hypersensitivity reaction tuberculate. So you will never see erythema induratum in the patients of Behçet's disease. What is this? This is a patient of Behçet's disease. It can present with the features of erythema nodosum, that is true. Furunculosis, that is also true, and superficial thrombophlebitis is also true, but erythema induratum is something which you will never see in a patient of Behçet's disease. Now, what is a Behçet's disease? It's a neutrophilic dermatosis. So here the neutrophils are getting accumulated inside the skin, giving rise to the features like orogenital ulcers, involvement of the eyes, then joint involvement. You can also have cutaneous involvement in the form of furuncle, erythema nodosum, and superficial thrombophlebitis. Clear? Next question is on your screen. Please read the question very carefully. Sai Priya, Dr. Priya, Pancake, Farhad, Nayak, Shubham. What will be the correct answer here? A 24-year-old female, a known case of immune thrombocytopenic purpura, was transferred from the peripheral hospital with fever and dyspnea. She was a regular patient with a proper follow-up, and she was on IVIG for immune thrombocytopenic purpura. But because she is not responding to IVIG alone, she was shifted to oral Depson. Now, physical examination reveals that there is tachycardia, tachypnea, and the oxygen saturation is getting down by 79% of the ambient air. You have peripheral and central cyanosis. So, on starting the Depson, patient started developing cyanosis. And please remember, this is because of a very important side effects of Depson, that is, it converts oxyhemoglobin into methemoglobin. And methemoglobin have reduced oxygen carrying capacity. So whenever you start a patient on Depson, and if the patient has cyanosis, it is always advised to go for an arterial blood gas, and we have to measure the methemoglobin levels in those individuals. So the correct answer of this question is option number 1, that arterial blood gas with methemoglobin levels should be done as a next step because of side effect of Depson. Next. What is the answer here? I hope you can see the image. I'm moving it a little left so that it becomes better visualized for everyone. A 21-year-old male presented to Derma OPD with complaints of foul smelling, axillary sweat. On examination, following finding was seen. Which of the following can be the cause? The correct answer of this question is Corynebacteria tenuis. This is the case of Trichomycosis axillaris. It's a case of Trichomycosis axillaris. So please look at this image. The axillary hair, it has some concretions over it. Can you see the concretions over the axillary hair? These are nothing but the colonies of Corynebacteria tenuis, and this disease is known as Trichomycosis axillaris. Is this clear? Marzina, Sai, Pancake, Farhad. Amazing. Next question. What will the answer of this question? There are two images given attached here. 2-year-old boy referred to our clinic with intractable pruritus, scaling, dry skin, generalized eczematous lesion resistant to atopic dermatitis therapy. During the following 7 months, the desquamation resolved, but ultimately the patient developed generalized pruritus. Erythematous lesion. On further examination, there is lustreless, dry, sparse, brittle hair, and trichoscopy shows following picture. What will be the diagnosis? Okay, so the correct answer here is Netherton syndrome. This is a case, or this is an image of Trichomycosis axillaris. Trichomycosis, not Trichomycosis axillaris, Trichorexis invaginata. This is Trichorexis invaginata. Trichorexis invaginata, because one part of the, or one portion of the hair is getting invaginated into another. And if you look at the image, the second image, you can see that there are double-edged scales. There are two edges of a scale. It is attached from the center and it is raised from the side. So these are very classical double-edged scales of Netherton syndrome. You have erythroderma, which is present here in these individuals. Atopic dermatitis. In addition to these two features, one is Trichorexis invaginata and another one is the double-edged scales. Clear, everyone? Next question. Anybody can tell me the answer here? A 45-year-old HIV positive male reports to the Department of Oral Medicine and Radiology with the chief complaints of burning sensation on the tongue, cheek from the past 3 months. The intraoral examination reveals erythematous patches on the tongue. Pseudohyphae was seen. What is your answer? Candidiasis, hairy leukoplakia, herpes or SCC? Very nice. The correct answer of this question would be option number 1. Pseudohyphae is a clue, and erythematous patches means it could be acute erythematous oral candidiasis, which is very common in HIV patient. Acute erythematous candidiasis. Acute erythematous oral candidiasis, which is very common in a patient of HIV. Clear? Next image or the next question is on your computer screen. Okay, so Satvik, I think that is your decision, because if you want to take dermatology, even DDVL is not a bad option. Just look at the hospitals or the colleges where you are getting this diploma seat. You can practice, you can have your own private practice after doing a diploma in dermatology, but for working in a medical college or in some institutions, you might need to do secondary DNB following the DDVL or diploma degree. So if you actually or seriously want to have dermatology as your dream branch, or if you want to take derma, you can definitely take a diploma seat now and you can start practicing after 2 years. And if you want to join an institute like a medical college, you can anytime do a secondary DNB, and you can be posted in your medical colleges like that of a MD student. Okay. Can you tell about hairy leukoplakia? Please remember, oral hairy leukoplakia it's a disease which occurs secondary to the Epstein-Barr virus infection. Usually Epstein-Barr virus causes systemic illness like infectious mononucleosis, but sometimes it causes a very localized lesion on the tongue, specifically on the sides of the tongue, which is known as oral hairy leukoplakia. They can even cause purpuric lesions in the extremities in children, which is known as papular purpuric eruptions of the childhood. So these are some of the different type of features which you can have. DDVL means Diploma in Dermatology and Venereology. Okay. So a patient comes with the following lesions in his shoulder and the chest. The lesions are scarring in the center. What is the most appropriate treatment for this condition? The correct answer of this question would be option number 3. Whenever they say that in a plaque there is scarring also and activity also, at one margin there is scarring, at another margin you have the activity of the lesion, please remember it has to be a case of cutaneous TB, and the most frequent cause is lupus vulgaris. So for these individuals you have to give anti-tubercular therapy. You give ATT of 6 months, where 2 months is intensive and 4 months is a continuation phase. Next question. What would be the answer here in this question? A man aged 30 years presented with the following pustular lesions. He has been taking treatment of acne with doxycycline, and his other acne lesions like papules, comedones subsided with treatment. But these pustules developed and were unresponsive to the medication. What is the most likely diagnosis? Anyone can tell me the answer? A man aged 30 years. What will be the answer here? Very nice. Please remember the correct answer of this question would be gram-negative folliculitis. Now it has been clearly mentioned that the patient was a known case of acne and he was on an antibiotics. Now, if an acne patient is on antibiotic, the acne lesions should respond. But in addition to the response in papules and comedones, we are seeing that the pustules are non-responsive, and it means that in addition to the features of acne, there are some other infections which are giving rise to folliculitis, or which are giving rise to pustule, and this could be because of gram-negative folliculitis. Now, why this is happening when the patient is already on an antibiotic? It is possible that the antibiotic which the patient is taking, it is a narrow spectrum antibiotic, and the infection which is having here, it is from the drug which is non-responsive to that antibiotic which he is taking. So for those cases, we have to give an alternate antibiotic, like you can give, or you can change the doxycycline to some other group like erythromycin, etc., that can cover the gram-negative infections, and that is why the correct answer here is option number 3. Okay. So erythromycin works very well. Okay. And why not pustules? Yes, pustular acne. Why it is not pustular acne? Please remember, acne, the reason for the pustular acne is what? There is proliferation of P. acne, Propionibacteria acne, which is a bacteria. Now, Propionibacterium acne, it is considered to be susceptible to doxycycline. Okay, and it should respond. If it is pustular acne, it should respond to the treatment of acne, but it is not responding here, and that is why we are suspecting the infection from some gram-negative organism. Clear? Ma'am, in folliculitis, can there be pustule? Yes, definitely. In superficial folliculitis, what is pustule? See, this is a hair which is coming out like this. If you have inflammation here, you can definitely see a pustule. You will definitely see a pustule if the infection is here at the top. Okay. I hope all the doubts are clear. Marzina, Pancake. Now there is a open house session which is starting in the next 4 minutes. I request all of you that this would be the last question. Please download the Unacademy Learning app and join my open house session today at 5 p.m. It's a free session for all of you. No subscription is required. The topic is 3 mistakes to be avoided. 3 mistakes to be avoided in exam. So that would be the topic today, which we will start at sharp 5 p.m. Clear? Okay. So a 55-year-old farmer presented with a black mole on the cheek. It increases in size, become irregular, and invade the deep tissue. What could be the diagnosis? Please remember, black mole with a deeper involvement has to be a case of nodular melanoma, and please remember, nodular melanoma has the worst prognosis compared to other 3 types mentioned. With this, we are done with today's session. I request all of you to please subscribe this YouTube channel, that is Let's Crack NEET PG. It's a free YouTube channel. We also have a Telegram group with the same name. What next? We have, if you want to take an Unacademy subscription, use this code CHESTA10, and please give thumbs up to the video if you like, and please press the bell icon so that you get all the notifications of my classes. See you all on the open house session which will start in 2 minutes. So please download the Unacademy Learning app and